Okay, so I'm going to start by reviewing the patient's medical record, looking at any recent lab data, any food or medication allergies, or any other information that might be pertinent to giving the medication, such as the need for PPE. And then I'm going to be verbalizing the drug class, the reason the patient's getting the medication, and any monitoring parameters I need to be aware of. After that, I'm going to open up the EMR and acknowledge any new orders. Then I'm going to locate the drug to be administered, and I'm going to verify the 5 rights, including the right route, the right dose, the right time, the right patient, and the right medication. As I'm removing the medication from the Pyxis, I'm going to be confirming that it's not expired. I'm also going to be doing any dosage calculations at this time, and I'm going to be verifying the compatibility of the medication with the primary infusion that's running. And I'm going to be gathering my supplies. So get all that. Okay. And then after I've gathered my supplies and done my dosage calculations, I'm gonna lock the Pyxis and go to the patient's room with my WOW outside or into the patient's room. I'm gonna do my first 5, so introduce myself, hand hygiene, provide for privacy, identify the patient, and explain the procedure. I'm gonna assess for pain, and I'm gonna do my second check of medication administration by scanning the patient's wristband. I'm also gonna be asking them if they have any allergies at this time and comparing that information with what's in the MAR. And then I'm gonna be scanning the medication. Again, maintaining the 5 rights of medication administration. And then I will be assessing the patient's IV site. I'm going to be looking for any signs of infiltration, or if the patient, if the IV line tubing is kinked, or I just want to make sure that it's patent. Then I'm going to be reconstituting my medication to get it ready. So I'll have my blunt needle syringe. I'm going to tighten the lid on there. And then moving to the reconstitution part of the administration. I've already verified the order, and I've already gathered my supplies, so I'm going to be removing the vial caps from the medication. Remove the vial cap, and then I'm going to be cleansing the port, and allowing them to air dry. Then I'm going to be drawing up the amount of diluent that I need in air, and taking off the syringe here. I'm gonna place the needle in the diluent, keeping it above the level of the liquid. I'm gonna expel any air, or expel the air. I'm gonna invert it, allow the syringe to fill with diluent, 3 mLs. I'm going to expel any air bubbles. Okay, expel any air bubbles. Confirm that I have the right amount. Reinvert. And then inject the medication or the diluent into the powder. Take out my needle. Recap the one-handed technique, maintaining sterility. And then I'm going to reconstitute my medication. Making sure everything is nice and dissolved. Once it's all dissolved, I'm going to be doing any medication calculations that I need at this time. I'm going to be determining the concentration of the medication. And then I'm going to take a new sterile alcohol swab and cleanse that. And then I'm going to be letting it dry, inserting the needle, and drawing back the amount of medication that I need. picture in this thing is all funky. Okay, so 2 mLs, expel any air bubbles, and reconfirm it's the correct volume. Reinvert, recap. And then if I was doing like an IM injection or sub-Q injection, I would change the needle size for the kind of medication, the administration site, stuff like that. Then once I have my medication ready, I'm going to explain. I'm going to do my third check, so I'm going to just maintain the 5 rights of medication administration, and then I will explain the medication to the patient and allow for the right to refuse. If they agree to move forward, then I will go ahead and take any vitals that I need prior to administering the medication. And then if I haven't already, I would be determining the push rate for the medication so that I know how fast to give it through their IV. And then I will be putting on clean hand hygiene, put on clean gloves. This is my little patient over here, Mr. Moose. My patient. Okay. So the first thing I'm going to do is take their INT port with a alcohol swab. I'm going to cleanse it, allow it to dry. I'm going to have to cleanse it again because I forgot to open this. Okay. Here's my saline. Okay, so I'm going to cleanse it again. Let it dry. Now it's sterile. And take my saline and I'm going to attach it here. And then I'm going to be pushing 5 mLs. While I'm pushing the saline, I'm just looking for any infiltration at the IV site, and I'm also assessing for resistance. If resistance is met, I would remove the saline and assess why there might be resistance, and I'm also going to be looking to see if the patient is having any pain while I'm pushing the medication. And then once I flush it, I'm going to remove that, and I'm going to cleanse this again with a new alcohol swab. Let it dry. Attach my medication. I'm not actually going to push it because it's going to get all over my table, but I would be pushing the medication at the prescribed rate. Oops. And then I'm just assessing the patient, again assessing the IV size and pushing it. Then I'm going to remove that. Cleanse it one more time, and with a new saline flush, this is a new one, I'm gonna, this cap would already be on it, so with the new one, I'm gonna remove the cap and attach that to the cleansed port. I'm gonna push an ml at the same rate that I pushed the medication to flush it out of the line, at the same rate that the medication went in, and then I'm going to flush with an additional 3 mLs. I realize I just said 5 mLs in the beginning. I would flush to start with 3 mLs, and then I would flush after the medication with 1 ml to clear the line at the same rate, and then 5 mLs to clear out the rest. So I push 5 mLs here, and then I would remove that, secure the tubing, retake any vital signs that I need, dispose of all my trash, remove my gloves, hand hygiene, lower the bed, give the patient their call light, ask if they need anything else, document the administration, and then reassess within 30 minutes for any side effects.